fallopian tube. Now what is the length of the fallopian tube? It is 10 centimeter in length. Okay, now what are the parts of the fallopian tube? It is 4 parts. First is this interstitium, then we have this isthmus, ampulla, and the other one is infundibulum. Let us see about this interstitium. Interstitium, it is also known as intramural part, and this is present inside the uterus. Now this is the narrowest part of the uterus and it acts as an anatomical sphincter. Okay, there is circular muscle fibers present, so it is an anatomical sphincter. Then is the isthmus. Isthmus is the second narrowest part and it acts as a physiological sphincter. Why? Because the product of conception which occurs here, it moves from isthmus to the ampulla. So ampulla is the widest part and this isthmus is the second narrowest part, and this is the site for the female sterilization. Whatever we do, female sterilization like tubal ligation, all these things are done here in the isthmus. Then third is the ampulla. What is the function of this ampulla? Ampulla is the widest part of this fallopian tube and this is longest as well, widest and longest. Now this is the site for fertilization and ectopic pregnancy. When we see ectopic pregnancy, the most common site for this is this ampulla. There are some mucosal folds and we call those folds as plicae. So these mucosal folds, these are maximum in this ampulla. Then the last part is the infundibulum. Infundibulum is also known as the fimbral part of this. We can say this fimbral-like structures. So fimbral part of the fallopian tube. Now there are some terms like, what do you mean by adnexa? Adnexa is ovary plus this fallopian tube, and there are some peg cells. It is present in the lining of this fallopian tube. Now genital TB, that is the most common which affects the ampulla part. Okay, is in this ampulla part we can say this genital TB, and this can lead to the blockage of this bilateral cornual block. Okay, we know the cornual is the junction between the uterus and the fallopian tube, so this will lead to the blockage of this cornual block. Then gonococcal infection. Gonococcal infection, that will block this fimbriae. Okay, so this fimbriae part will block by if there is any gonococcal infection, that will block this fimbrial part. Then what is the investigation of choice for this tubal patency? We do HSG. What is HSG? HSG is hysterosalpingography. Okay, let me write it here. Hysterosalpingography. Okay, hysterosalpingography. This is the investigation of choice for this tubal patency. Now what is the site for this tubal ligation? We have just read that tubal ligation is most common in this isthmus part. So laparoscopy, if we do by laparoscopy, then we go for this isthmus. Okay, laparoscopic, but hysteroscopic, it is done in the interstitium. In this interstitium part, we do this hysteroscopic using a device that is known as SCOR. Okay, hysteroscopic using a device that is ACOR. Okay, so these are the site of this tubal ligation. Tubal patency, there would be some doubt like what is tubal patency? Tubal patency means that we will check that if the fallopian tube is open or is there any block inside it. So we do it using this HSG, that is hysterosalpingography, in which we do X-ray. Okay, and we see that if there is any block or not in this fallopian tube, if it is open, and we also check the shape of this uterus and all these things.